There you go.
Hi, everyone. We're really sorry about that. It seems that our audio is down, but...
So let's give that another shot.
Yes, so, sorry about that.
Good morning, everyone. What you've missed so far is that my name is Dan Ferris. We did a little bit of housekeeping and told folks that we'd be getting started in just a minute. So hopefully now, while we were sorting out the technology on our end, you've sorted it out on yours. I'm joined here today by Morgan McGuire and Andy Kleek from the McSilver, CTAC, and MCTAC teams. And we're going to dive right in. So we'll have a lot to get through in the next 25 minutes or so. Thanks for your patience on the tech front. So just a quick housekeeping note or two for folks. So please chat in your questions using the chat function on the right. There's a little chat icon either on the bottom right-hand corner or the upper right-hand corner. When you do that, please just be sure to do it to all panelists. So everyone over on this side can see the questions as they come in. We can manage that as we can get quite a few questions at a time. And because of the nature of this presentation in particular, please do feel free to chat in your questions as they arise throughout the presentation, and we'll address them as they come up as best as we can. Just so you know, slides are posted at mctac.org per the usual, and a recording will be available soon. We say usually less than a week, just in case there are any technical difficulties. But usually it's a lot quicker than that. And just so if we move on to the agenda, so today we're going to be doing a very brief MCTAC overview and then also looking at the database tool itself for output to outcomes. A quick walkthrough of some of the measures that are available and some of the functionality to help you look through some of the behavioral health assessment tools that are captured in this database. And then we're going to start to do a very introductory high level of using measures to understand your population and how all of this fits in with a general system transition towards value-based and outcomes-driven practice. And with that, we're going to turn things over to Andy, who's going to do a very quick 101 of what is MCTAC.
All right, so the MCTAC is the Managed Care Technical Assistance Center, and since 2014, we have been working with all mental health and substance use providers in New York State. We also work with the child welfare providers in New York State, really with the idea of helping them make the transition to managed care, both initially and then on an ongoing basis to help them be most ready to adapt to the transition to managed care, all from contracting to billing to and all of those kinds of things. We have a number of partners. MCTAC is primarily led by the McSilver Institute for Poverty Policy and Research, where Dan Morgan and I work, and also CASA Colombia, actually CASA, the National Center on Addiction and Substance Abuse. We also have a number of other partners, including CCSI, NIAFRS, Families Together, ICL, and IDEAS. Okay.
All right. So now we're on to the site overview, and we encourage everyone who hasn't registered already to just very quickly register now so that you can follow along. The URL is outcomes.ctecny.com. And so this project was developed to help behavioral health providers improve quality of care while lowering health care costs as part of the triple aim of managed care. And this assessment database is geared towards practitioners and as well as organization decision makers to identify and access clinical measures that have been proven reliable, valid, and sensitive to treatment. And this is going to be a part of a larger effort to build provider capacity around outcomes and while disseminating project tools. So the database was created by the McSilver Institute for Poverty Policy and Research in collaboration and thanks to the generous support of the New York State Health Foundation. And so we suggest going back to the registration page if you haven't done so already. Sorry to be the dead horse here. But if you go to the registration page, our registration system is modeled after the webinar registration system, so we're hoping it's relatively straightforward and that you're familiar with it. And if you have any issues, just make sure you're using a recently updated browser such as Chrome or Safari. And then if you want to browse by outcome, just hit the Search Now button on the top right-hand corner of the landing page, it should be highlighted in orange. And there you'll see all the various outcomes: behavioral health, daily living and recovery, global screening, physical health, relationships, risk management, and substance use disorders. So as you can see, there are quite a variety of measures. And to search by keyword, if you're looking for something specific, you can type in on the top left-hand side under the Define Search box something a keyword you're interested in finding, such as anxiety, or if you're looking for the Beck Depression Inventory, for example, you can just type in Beck and that will pop up. And we thought it would be helpful for providers to recommend measures to other providers. So if you click on the specific measure you find useful or that you're looking to recommend to other providers, there's on the top right an option to click, I recommend this measure, I find this measure useful. And we find that that's very helpful for providers who are looking for feedback and input on what other providers have found most useful. And the advanced search is back where the search by keyword is. And if you scroll down, there's quite a few options. You can search by measure type, population, which would be age range mostly, and then different indicators. All right, and so this is a home page. What you'll see if you haven't registered. So right under Dan's name and email is the Register Now button and the search functionality. And then the browse functionality. So you'll see at the top the different outcomes buckets that I listed before. And then on the left-hand side, the beginning of the advanced search.
And just for folks who are interested, we've gotten a couple of questions to repeat the website again, and we just chatted it out to all participants. But in case you're not following along in the chat box, the URL for the site is outcomes.ctacny.com.
And you can also get there by going to MCTAC.org. It's also on our MCTAC.org website when you get off the webinar and forget what the link is again.
All right, so as you saw before, there are a bunch of different outcomes categories. And just to clarify, relationships, we find those measures particularly useful for family support treatment, different modes of treatment where families are involved. A lot of those measures are family-based. And then risk management is mostly related to suicide prevention measures and suicidal ideation measures. So we've gotten some questions in the past what the difference between outcomes and indicators are. And outcomes would be the main bucket, so behavioral health, substance use. And indicators are the subcategories. So if you're looking for PTSD measures, just click behavioral health symptoms, and then all the PTSD measures will appear under that bracket. Some that have that fall under multiple outcomes, such as behavioral health and substance use or behavioral health and risk management, will be listed under both, so you can search both if you're unable to find it in one. And as you'll see under the advanced search, under type, there are two different types of measures, screening and progress monitoring. So you can find that by scrolling down on the defined search closer to the bottom. And screening measures are designed for diagnosing and screening, and a lot of these measures can also be used to monitor progress. So if you want to see how a client has progressed in their symptoms, you just change your measure type to progress monitoring. And so using outcomes to inform your practice, the big question of why this database was created and why it's so important in the new healthcare environment. So to succeed in this environment, all levels of staff must be engaged. It's not enough that just the clinical staff or just the program directors are engaged. So the clinical staff will be on the ground with the measures in this database, collecting, monitoring, reviewing. And then the program directors will use this data and gather it for each service and program type to understand how things, the applicability of each measure within the program. And leadership will use these decisions to inform their decisions about staffing, contracting, negotiation, and leverage, which is the big audience of MCTAC, all those trainings we do about contracting. This will help you figure things out. So frequently asked questions. We do have a section on the website up at the top that answers all these questions, but we thought we'd go over them now as well. Difficulty of registering. We have found that the main issue with people who've had difficulty registering is actually a browser issue. So if you just update your browser or use a different one, it will work. Oftentimes, if you're using an older browser, it'll give you exclamation points saying the field's required, and you've already filled it out. So if you see that, that's what that means. And then the $sign indicates a measure that you have to purchase in order to use. But we have a lot of free measures. So if you just check off the free measure tab on the top left-hand corner, it'll just show those. And you can also just scroll around and find ones that don't have the $sign. So sensitive to treatment is an option we have listed under the larger description of the measure when you click on it. And that just basically means that it's been tested at pre and post test. So those measures are ideal for progress monitoring. And reliable and valid also means that they've been subject to a research study, and they could either be sensitive to treatment or they're just geared towards screening and diagnosis, but it basically means that research has proved that they're good to use and they'll help you out. And if you can't find the measure you're looking for, we strongly suggest, and we've actually gotten a few emails about this, and thank you for those who have reached out, please just send us the name of the measure and we will look into it and try to update our website as soon as possible, because all your recommendations, we very much value them. All right, and I'm going to let Dan and Angie take over from here. Sorry about that.
Great. All right, so before I jump in, if we're just doing a little bit of shuffling here at the computer. So before we talk about additional tools, we just wanted to click through really quickly and demonstrate what Morgan just helped to talk folks through. So as you see here, when we talk about the search versus browse, if you have a pretty good sense of what you're looking for, it's right here in this field, and you can type in keywords of whatever range of things that you're looking for. In terms of choosing an outcome category, it'll allow you a better opportunity to reduce the number of measures. There are 365 measures in the database, so if you're looking to kind of narrow down your search criteria, this is a great way to do it. Also, the $sign that Morgan mentioned here, and there's a hover over pop-up in case you forget whether it means that it's free or whether there's a cost. We'll remind you right here in the hover up. And then user recommended is actually a function that we'd really encourage folks to use, both for informing your own work, but then also for informing your colleagues and peers what measures you might be using in your day-to-day activities. So when you're looking at a measure itself, all the information that's available is including the year, categories, the languages it's available in, whether it's valid, reliable, sensitive to treatment, and then also you have the option to recommend this measure. And again, with hover over functionality, if you need more information about what that feature is all about. Great. And with that, we're going to move just into a really quick overview of additional tools. The Output to Outcomes database is just one of many resources and tools that CTAC and MCTAC have developed over the last few years. Just for the purposes of this presentation, we're going to be focusing mostly on managed care relevant tools. But I think the general idea, and this holds true for both the Output to Outcomes database as well as the Matrix, which many of you are familiar with, the Managed Care Glossary, and top acronyms guides. The idea here is that any time that individual agencies or providers would need to spend valuable person hours and resources pulling together a resource or tool for you to use internally, instead of having 900 agencies and thousands of programs replicate the same work over and over and over again across New York State, MCTAC is happy to step in and work with the plans, the state, and providers to pull these together in a centralized location while still giving you the flexibility that you may need in order to customize, in order to suit your own needs. So again, just a quick overview, and all of these are available at mctac.org. That's MCTAC, M as in Mary, under the Tools and Resources page. So, for example, the Managed Care Matrix, instead of having all providers pull together information about the various managed care organizations and plans across New York State that they'll be contracting and billing and working with around utilization management and authorization, there's one central place, and a big thanks to the Plans and Plan Association for their help in cultivating that information. So it doesn't have to be tracked down for each individual plan by each individual provider on a reoccurring basis. Also, we mentioned the glossary of terms, top acronyms, and managed care language guide. If we were in a room together, we'd say raise your hand if there's an acronym that you don't know what it means. Everyone's hand would go up, including ours. So the top acronyms are some of the things that you'll hear most frequently, and we encourage folks to even print it out and just stick it up on their wall, as I believe Andy, myself, and a couple of others of us here have done. And then just a couple of other tools that are coming down the pipe and will be released soon. So there's a interactive FAQ tool. So, you know, the FAQs are typically shared in PDF form, and it doesn't make for the best search functionality or search capabilities. So we've taken and created, and we'll hopefully be releasing in the next few weeks, that tool. And then also something, it's an interactive billing and claims form that contains critical information for what's known as clean claim submission with field-by-field details. So if you've been to any of Boris Vilgorin's presentations on integrated billing for managed care, this is a great supplement to that. So if you have questions or need information about the billing form or process in submitting clean claims, you don't necessarily have to rewatch 3 hours of Boris's presentation, as much as enjoyable as it is. But the tool kind of will allow you to look at individual fields and areas that you might have a specific question about.
And before Dan moves on, we've been getting some questions. These tools are going to be accessible through the mctac.org website and not the Output to Outcomes website. So just wanted to clarify that.
Thanks for clarifying. And if anybody does have registration questions or not, you're welcome to chat them into us now, or you will pull up in just the next slide, actually, questions and discussion. So if you do have questions, or if you have difficulties registering when you get back to a computer, if you're listening in now via phone, you can just please send us a quick note at mctac.info@nyu.edu. We're capturing all the Q&A here, so you can also chat us in, and we can chat it in, and we can follow up with you shortly about any registration difficulties and forward those over to our tech team as well if they exceed our technical capacity for browser functionality. So with that, we're going to open things up for just a few minutes of questions and discussion just about the tool itself and how it might be useful in your work. So we'll give folks a few minutes, or a minute or two, just to chat those in, and we'll get started with Q&A in just a minute.
So one of the questions that came in is, can the assessment tools be used in a non-clinical empowerment peer organization? And actually, yes, absolutely. There's a whole section devoted to recovery-oriented measures, and I strongly recommend you look at that section. And actually, in developing that section, we work really closely with NIAPRIS with exactly that idea in mind. So one of the other questions that came in was, it asked you to list yourself as a clinic, and we originally decided to pull this together. We were just working with clinics. So if you scroll down on the list of options, you can, one of the options available is other. Please click that for now, and I think as we develop this further, we'll have more options available for folks. It's been a really good question that's really complex, but we'll do our best to answer today. In value-based care, will managed care companies be happy with pre- and post measures that target symptoms like the BDI, et cetera, or will they require use of a particular evidence-based treatment with data to support that it works? So I think the answer to that is yes to both. I think, you know, one of the things to start to consider as you start to prepare for value-based payments is value-based payments will not all be about clinical care. Some of them will be about process measures. So, for example, incentivizing access, so getting somebody within 24 hours or 48 hours, stuff like that. But also, obviously, value-based payments will also work on improving clinical care. I think there will probably, you know, and this is me speaking my own opinion, not necessarily where the world will go. I think there will be obviously incentive to work, you know, with particular types of evidence-based practices. But I would argue that actually the plans are going to care less about the type of evidence-based practices being used and more about the actual demonstrated outcomes. And some of those outcomes will be about symptom reduction, but some of those outcomes will also be about quality of life improvement. So keeping folks housed in the community, helping people get jobs, helping people make sure that they stay out of the ER and hospitals. So I think the answer to your question is yes on both fronts, but I think it's also important to just think, as we start to develop that, we're going to want to think a little more broadly than just strictly symptom reduction. So two things. There were a couple questions about whether we have HEDIS and QAR measures built in. We will be. They're not actively in there right now, but one of the things that we're looking for in the future is not only to build in HEDIS and QAR measures, but as there become state-mandated measures for value-based payments, that we would also build those in. They'll probably get their own tab at some point, but we're not quite there yet. The other piece that I would also encourage, and we're going to do some more development on there, but there's probably some tools in there that you can access now, is if you're an HCBS provider, to start to look at some of the tools that are available here and see if they might, for your own internal organization, meet the access requirements that you think you're going to need to assess for HCBS services. Because one of the things that's being required by the state is that each provider do an HCBS assessment for the individual. So like if somebody comes to you for employment services, that you do an employment assessment. And so we're going to make that area of our tool more robust as we move forward, but also you can look through there now as we start to get ready.
Great. And just a couple other quick things as we're pushing up against 11:30. So is there information more specifically on age ranges? So if you use the sidebar, that's available once you're registered into the database along the side of the list of measures. If you scroll down below the indicator, the type, there's age range and language at the bottom. And so age range includes adults, adolescents, children, and seniors. We didn't define the specific ages that are included in those areas because different measures in different states categorize adolescents differently than others. But so just we would encourage folks, if you're looking for an example in the question specific for young children, 0 to 5 years old, to filter by children and then to look at what's available and see which would be most applicable to the specific population you're looking for. And then we also got a question about the cost of the database. And the database is completely free, 100% free and public after you register. But that's just to say that not all measures that are included in the database are free. So the measures aren't the property of CTAC or MCTAC or the McSilver Institute, but this is a resource to point you in the direction of those, and then we leave it to the agencies and clinics and directors and clinicians to decide if there are multiple options for assessment measures on which one best suits the needs of your particular agency and organization.
Again, one more question about whether this relates to the tools and not the actual benchmarking of results. So it does. So this is the outcome database, which all that's on the database is the tools that are available, and you can download them and use them as you'd like. We are working kind of the second phase of this project, working to develop a method that agencies can more strategically and systematically measure their outcomes, probably starting with process measures. And so more information on that coming soon. But we wanted to get this part out there and publicly out there for folks at the beginning.
Great. And also just wanted to say a quick thanks to the folks who have sent in other clarifying questions or even suggestions for additional things that would be helpful with the tool, including scoring and delineating age ranges better. So please continue as you're exploring the site to send those suggestions our way. The email is there on the screen, mctac.info@nyu.edu. And we'll continue to maintain and develop not only the measures that are available on the site, but the site functionality so it best meets the needs of providers. So with that, we are a couple minutes past 11:30. So thanks again for your patience up front with the technical issues, and especially to Morgan McGuire for leading through a great walkthrough of the tool, and Andy for contributing to some Q&A, some helpful answers about where the world's heading with value-based payments and how this tool fits into that. So with that, we're going to sign off. But again, thanks again. Register for the site if you haven't already at outcomes.ctacny.com. And we truly look forward to hearing your feedback about the tool and continue working with you in this area moving forward. Thanks so much, everyone.
All right. Thanks, everybody.